My guest on Conversation this morning is Dr. Andrew Manista, and he is with the Olympia Orthopaedic Associates. And we're talking about an event coming up having to do with back pain, coming up on Tuesday, April 21st at 6 p.m. at the Olympia Orthopaedic Associates location at 3901 Capitol Mall Drive Southwest in Olympia. I want to get that out up front. Doctor, we're talking about back pain. What are we going to talk about at this seminar?
At this seminar, we'll be addressing sacroiliac pain. That is the joint where your pelvis and your spine actually meet.
Okay, and I'm looking at a flyer here that says, do you have any of the following? And you want to read that list there? That's kind of interesting.
Well, the sacroiliac joint is famous for giving pain that's located somewhat between the lumbar spine, which is the low back, and the hip. So frequently people present with buttock pain, hip pain, sometimes groin pain, and sometimes even leg symptoms.
And I like one of the questions down below that's aimed at whoever sees the poster. It says, do you have difficulty riding in the car? Now, I sometimes, when I go for long drives, in fact, sometimes within a half hour, 45 minutes, my lower back starts really hurting and I feel like I have to get out and walk around. Are we talking about that kind of pain or something else?
Well, that kind of pain can happen for a variety of reasons. Very commonly, people can have arthritis of the lower back or lumbar spine that can lead to that sort of discomfort. Similarly, people with hip pain will find it very difficult to get out of a car after a long car ride. But the sacroiliac joint, which is the junction of the spine and the pelvis, can give symptoms that mimic either one. So you can actually have that sort of pain from any one of those three conditions. And the goal when we see patients in the office is to distinguish which is the condition that's causing them their pain. Once you know what the condition is, it's a lot easier to treat.
Now, I'm pretty sure that the reason we're doing this interview here now is to point out that there are some new techniques. And now I understand that what you do here at the Olympia Orthopaedic Associates is something that's relatively new, something within the last 5 years?
That is correct. We've been able to work with some new technologies that have come out that allow us to address the sacroiliac joint surgically in a minimally invasive way. Previous to this sort of technique, the fusion surgery for the sacroiliac joint was, let's just say, a complicated and big deal. Now that it can be done through minimally invasive techniques, we're able to minimize some of the side effects and tissue issues that can occur with a major open surgery.
So how long do you have to stay in the hospital, or do you even go to the hospital?
It is done in the hospital, and typically the stay is less than one night.
Less than one night. How does that compare to the old complicated ways?
Usually the older open way would be a 4 to 5 night stay. Typically our patients are out within 22, 23 hours.
Now, I think I saw a statistic that something like 85% of the people who have this procedure are greatly improved.
That is a very nice statistic. I think that it's very important when you talk about statistics that you realize what the sample group was. In patients that have documented and proven sacroiliac pain, this procedure can be very effective. When you look at all comers that come into the office with various different back and hip pains, the success rate won't be as high if you're not applying very strict criteria. It's very important that you figure out exactly where the pain is coming from prior to doing this procedure. The success rate is very high in patients that have well-documented, very clear sacroiliac dysfunction.
Now, how do you find out whether you're in that category where this is going to work?
The way that I do it, and my colleagues in my group, are the first thing we're going to do is take a good history from the patient. What are the kind of symptoms that they're experiencing? When do they occur? What makes them better? What makes them worse? And what kind of treatments have they tried and how have they worked? We'll then perform a physical examination looking for the various different features that would be seen with, say, lumbar arthritis, hip arthritis, or sacroiliac dysfunction, and try to piece the history from the patient with the physical exam findings. Then we'll look at imaging studies, x-rays, sometimes a CAT scan or an MRI, and try to analyze that data and mix that in with this history and this exam that we performed. And then lastly, sometimes we'll do what's called a diagnostic injection or a maneuver where you might say, for instance, put numbing medicine into the hip and see does the pain go away, or similarly injections around spinal nerves.
All right. Well, my guest on Conversation this morning is Dr. Andrew Manista with the Olympia Orthopaedic Associates here in Olympia. And we're actually, the reason we're on the air doing this right now is we want to get you interested in going to a seminar on Tuesday, April 21st at 6 p.m., and it's going to be at the Olympia Orthopaedic Associates location at 3901 Capitol Mall Drive. That's that beautiful new facility. How can you stand working in such a nice place?
It's a very nice place to work, and I'm fortunate to have a wonderful group of partners and patients to help keep that building full and active.
And I understand that seating is a little bit limited, so people really should make reservations. How do they do that?
Well, we would very much appreciate if people could RSVP at our email, lecture at olyortho.com. That's olyortho.com. Or RSVP at our phone number, 360-205-5858.
If you just tuned in, we're talking about back pain here. And Doctor, how did you get into this specialty?
Well, I actually had the good fortune of being exposed to some wonderful teachers when I was in medical school, and they happened to be orthopedic spinal surgeons, and it was their inspiration and their encouragement that helped me to go on to do the training I needed to get into this field.
And where did you get your training?
I went to medical school at Case Western Reserve University in Cleveland, and then went on to do internship, residency, and fellowship at Johns Hopkins in Baltimore, Maryland.
Pretty impressive background there. And you're still a young man. And, you know, one thing it kind of impresses me here in your office as we record this is Jackie was so enthusiastic. One of your helpers here. I don't know what Jackie does exactly, but she likes working here, and I think she told me that it's because so many happy people come out of here and are happy with the results of what happens here at the Olympia Orthopaedic Associates.
Well, we are certainly lucky to have Jackie on our administrative team, and she's done a wonderful job of helping to educate the community and our patients about what we can offer them and help us track the effects of what we're doing on them. It's very important in healthcare, especially nowadays, that we look at our results, analyze what we can do better, and make the appropriate improvements. And Jackie plays an important role in doing that, and we're very grateful to her.
Now, Doctor, let's get down to specifics a little bit. Now, I know because of confidentiality and everything, you can't, get too specific, but you've done this long enough now to know that there are some really good results. Can you give me some examples of some happy people out there that are, would have been miserable, but thanks to what you do here at Olympia Orthopaedic Associates, they're now leading better lives?
I think it's probably safe for us to talk about what the typical patient is with sacroiliac dysfunction. And in my experience, the typical patient with sacroiliac dysfunction has been having back pain for years and been told, there's not much that can be done, and they have kind of been passed around between this place and that place and tried a variety of different traditional and alternative therapies and really haven't gotten anywhere. Now that we're paying a little more attention as a specialty at sacroiliac dysfunction and looking at our lumbar spine and our hip patients and analyzing the sacroiliac dysfunction as a possible pain generator, I think we're identifying this condition better. And when we see these patients and we're able to tell them, you know what, I think I know what's wrong with you, a lot of times patients get some sense of validation from that after years of being told, there's nothing that can be done. Well, now that we know what this is, there is something that can be done. And very frequently, in fact, the vast majority of the time, those are non-operative treatments. Treatment with therapy, manipulative medicine, injections, sometimes anti-inflammatories, and most of the patients are going to make significant improvements with those changes. Sometimes just modifying an activity they were doing can be helpful. In those patients that don't get full relief from that or only get temporary relief from that, there are surgical procedures that can be done, and I'm very pleased to say that we are able to offer this minimally invasive version of that surgical procedure, and the results of which have been very, very good. The pain relief that people experience isn't just seen in the initial few months. It actually tracks out over years, which is really the measure of a quality surgery.
Now, I'm glad you're having this seminar, and it's free, because a lot of people, some people listening right at this moment, they don't want to make an appointment with a doctor just to complain about back pain, but they're curious about what you have to offer, and this is an easy way to get all kinds of information. And that's Tuesday, April 21st, 6 p.m. at that beautiful new Olympia Orthopaedic Associates clinic on Olympia's west side. And Doctor, what all are you going to cover during this seminar? What can people expect you to be talking about?
Well, I don't want to take all the credit. My good partner and friend, Dr. Taylor, Douglas Taylor, who is an anesthesia pain management specialist, will also be there. And between the two of us, we're going to talk about features that are consistently seen with this dysfunction, talk about treatment modalities, both non-operative and operative, that can be offered, and then we'll take questions from the audience itself and address their specific concerns. We'll use diagrams, some models, and hopefully be able to educate the people that choose to attend on these types of conditions and what treatment options are available for them.
I was looking at some notes having to do with what you might talk about, the SIJ dysfunction. This has to do with pregnancies and obviously women.
Well, sacroiliac dysfunction, or SI joint dysfunction, that's where the SIJ comes from, is frequently associated with conditions that either cause abnormal stresses on that junction between the spine and the pelvis, and pregnancy would be a great example of that. Trauma would be a good example of that. Or it can be associated with conditions that cause decreased motion either with the lumbar spine or hip, because that motion then gets translated to the sacroiliac joint. There is a disproportionate amount of women that are seen with sacroiliac dysfunction, and a lot of that has to do with birth trauma. Also has to do with the nature of a woman's pelvis, trending to have a slightly different appearance of the joint than men. They tend to have a little bit more motion, but these aren't rules so much as trends. There are certainly plenty of men that I see that have this condition and have suffered greatly with it and have responded well to treatment. So this is not a condition.
It's not just, you're not just going to talk about that, in other words. But there are people listening who've had an accident maybe years ago, maybe a traffic accident, or they fell off a ladder, or maybe they lifted too much firewood or something, and they've hurt their backs, and now they have back pain all the time. Are you going to talk to these people?
Absolutely. And in fact, part of diagnosing sacroiliac dysfunction is making sure that lower back arthritis and the residua of lower back trauma isn't what's actually causing the pain. And so we do spend a fair bit of time looking into those issues. And similarly with the hip as well. These are really, it's a triad of conditions, and trying to figure out which one is the exact pain generator is paramount to getting an effective plan for treatment.
There are some people listening right now who they sit for a long period of time in the office or wherever they sit, and it's painful. It's very, very uncomfortable and gives them a backache. How about these folks?
You know, I can tell a sacroiliac patient a lot of the times when I walk into the room, because they're the one who's sitting on one buttock. They're the ones that are kind of leaning on the chair there because they want to relieve the pressure on that symptomatic side. It's not unusual to have these patients bring in their own pillows, that they sit on a special pillow to help relieve that pain. Prolonged sitting on that one side, another factor that's very common with sacroiliac dysfunction is people can't stand to do a single leg stance on that side or hop on that side. So those are common features.
Yeah, so you're going to talk about all this at the seminar, which is Tuesday, April 21st at 6 p.m. at the Olympia Orthopaedic Associates clinic. That beautiful new clinic that's been open for, about a year or so now, and it's just, we're so lucky to have people like you in our community and such great medical facilities here. You must be pretty happy with what you do here.
I am very happy to have an opportunity to work in this community. I think Olympia is a great place to live. The South Puget Sound is just a real treat. And I am very privileged to have the patients that I have and the partners that I have. I feel lucky every day when I come to this job.
Well, I'm the one who feels lucky because you're in the same community where I live. Dr. Andrew Manista with the Olympia Orthopaedic Associates, thank you so very much for being on Conversation this morning. And I hope that a lot of people get a lot of good information at that seminar. Once again, that's Tuesday, April 21st, 6 p.m. at the Olympia Orthopaedic Associates beautiful new clinic at 3901 Capitol Mall Drive, Southwest in Olympia. And if you want to pre-register, and that's recommended, call 360-205-5858. That's 360-205-5858. Or you can email lecture@olyortho.com. That's LECTURE @OLYORTHO.com. Dick Poost for Conversation. You've just enjoyed an interview with Dr. Andrew Manista.
The proceeding was a paid advertisement for SI Bone and Olympia Orthopaedic.